Thank you. It's a great question. Pandora's box, when you open it, you have no idea what's coming up. That is true for anything which is very significantly curative, but also a brand new therapy and a complex therapy like CAR T cells and a few decades ago, a bone marrow transplant. I'll give you an example of a childbirth. The pregnancy of 9 months in humans is a laborious task for a female, and kudos to all the women in the world carrying the baby for 9 months. When the baby is born, the question is, that's when another story starts. A long-term story. What next? Now, who's going to follow the baby from childbirth till the teenage? That's going to be the fundamental question for any new therapy and a complex therapy that comes in medical world as well. Not that we cured a patient with leukemia and lymphoma, who's going to monitor those patients for the knowns and unknown complications in long term. So that's where the analogy of Pandora's box comes in. The fundamental principle of assessing the complications and preventing them in a patient after a CAR T cell is to have an organized, systematic fashion, a clinic called survivorship clinic for these survivors who got a CAR T cell, so that we can monitor the known and the unknown effects of the CAR T cells, whether it be new cancers, to have an eye on those, to screen them, or the heart complications, or the brain complications, or anything else, or the cancer itself may be coming back. We have to monitor that. And those kind of clinics called long-term follow-up clinic or survivorship clinics are needed much more today than ever, because people from all over the world are traveling to few centers which can do CAR T cell. For example, from hundreds of thousands of cities in China, they go to few selected centers to get CAR T cells for their leukemias or lymphomas or myeloma. When they go back, the first-year follow-up is great, but we need to have mechanisms to follow them up year after year after year. And this is true even for the young kids who get the CAR T cells, because what's going to happen when they're going to have babies? Who's going to actually assess the risk of them having normal kids in the future? Who's going to assess these patients from the age of 15 all the way up to the 50? It's our responsibility. So the way I envision this is having a very organized CAR T survivorship program in the hospitals which perform CAR T cells. Fortunately, most of the continents where we're doing CAR T cells, we're forming world-class registries. We've learned from bone marrow transplant field that these registries will give us a clue about the complications and late effects that happen after the CAR T cells. Now, once we've got mega data from them, for example, 10-year data of the CAR T cell of a group of patients, we would hope that the international registries will merge with each other so that we have more data, and then we'll be able to better predict by artificial intelligence methodologies, machine learning methodologies, that what are the individualized risks of patients based on the exposures, which is the chemotherapy, the CAR T cells that they had in the past, to predict what kind of complication they may have, whether it's cardiovascular, which is a heart, or brain complications, or new cancer development. So it will come from those precision medicine models based on machine learning, deep learning methodologies, which is AI, once we have the mega data assimilated, which we're accumulating now.